Hello and welcome to our session today on bone sarcoma. We're hoping that this session will be really useful for anybody who has recently been diagnosed with a bone sarcoma or their family and friends. My name is Helen and I'm a sarcoma specialist nurse by background, and I work at Sarcoma UK as part of the Sarcoma UK support line. And with me today I have Dr. Zoe Davison, who is Head of Research, Information and Support at the Bone Cancer Research Trust. Zoe, thank you for joining us.
Absolute pleasure. Thank you for inviting me.
That's great, thank you. So I guess really one of the key things is to discuss exactly what a bone sarcoma is. We know there are many different types and can affect any age and any bone and any person really. So Zoe, would you like to just kick off on something short about what bone sarcoma is?
Yeah, so bone sarcoma, or you might hear it referred to as primary bone cancer, it's a type of cancer that starts in the cells of the bone. And as you said, it can happen in any bone of the body, although it does seem to have a bigger incidence in the limbs. So in the lower limbs, the legs, and the upper limbs and the arms, where it has the biggest incidence. There are 7 types of malignant bone tumours. So osteosarcoma and Ewing sarcoma are the most common in young people, and chondrosarcoma and chordoma are the most common in adults. So that's a kind of whistle-stop tour of bone sarcomas.
That's great. Thanks, Zoe. And we know that roughly it affects about 600 people in the UK each year, and about 160 or 170 of those are young people and children. And so it's really important that because the numbers are low, we get a correct diagnosis for these people. And I guess one of the things that we're always talking to people about on the support line is the importance of the specialist teams and the MDTs. Why is it so important that we get people to those? And for some, that does mean a considerable travel distance, unfortunately.
It does, absolutely. So I think we both hear the stories, don't we, that the patients spend a long time trying to get a diagnosis, but things tend to move very quickly after they've got a diagnosis and when they get to the specialist teams. So a number of years ago now, sarcoma services were centralised. So bone sarcomas and sarcomas more widely are really complicated to treat. They often need chemotherapy, surgery, and in some cases radiotherapy. And healthcare professionals need a high level of expertise and specialism to manage the treatment and the care of those patients. And because of the rarity, it means that if those services were spread around every hospital, the healthcare professionals wouldn't see enough patients to keep their expertise and their skills levels high enough. So the services are centralised, and there are 5 surgical centres in the UK that deal with bone sarcomas. And so to get a diagnosis and to have surgeries, patients have to travel to one of these, often a long way. But it means that their care and their treatment is done by the experts and the specialists, and that really has improved outcomes for patients considerably.
Absolutely. And you're absolutely right. So we know that by getting people just in the door of a specialist centre, we can improve their outcome for up to 20% sometimes. So it is really important, isn't it?
Absolutely. It's really, really important.
And because people sometimes do have to travel, especially with the younger people that have the longer treatments, the chemotherapies and everything that can take months on end, it means sometimes that those people are away from home. And I think it's really important that we can emphasize why that needs to happen, because they do need to be cared for by the specialist teams.
Yes, absolutely. It's really important that they do come to those specialist centres. It's really tough. but they often have a combination of chemotherapies, 4 or 5 different ones sometimes, combined with radiotherapy sometimes. And it does take a real level of skill to be able to deliver that combination of chemotherapy at high doses, and to be able to manage some of the kind of side effects that come with that, and care for the patients holistically. So it's really important for them to come to those specialist centres. It does mean long stays in hospital usually, unfortunately, and lots of time away from school, from family and loved ones. And we know that it can be such a socially isolating time for youngsters. Can be really, really tough. There are lots of support. There's lots of support out there to help the youngsters, which we can talk about.
That's great. And one of the key things that we talk to people about a lot is the need for individualized care with bone sarcomas. So, we know that even with the title of osteosarcomas, there are different subtypes within that, and people will have different treatments depending on their exact type. And I think sometimes it's difficult, isn't it, for people to understand that although you've got the same diagnosis as in osteosarcoma, you don't always have the same treatments as somebody with the same name. And that can be confusing, can't it?
It can, absolutely, and it can be confusing and frustrating as well, I think. And there's a difference in treatment for older patients for osteosarcoma, for instance. And one example is access to mifemertide or Mepact, and patients over 30 can't access that. And we often get a lot of questions about why, and will this affect my outcome, and things like that. So it is a really confusing time. We always encourage our patients to talk to their clinical nurse specialist, and not assume that they'll be on the same treatment as someone next to them.
Absolutely. And you mentioned the clinical nurse specialists. They really do have a kind of a key role, don't they, in keeping everything together, and being a key kind of contact really between the patients' families and the clinical teams.
Absolutely, yes. We always make sure that patients that come to us have access to a clinical nurse specialist, because they are a real source of support. And not just for the patient, it's for the wider family as well, because you probably have this, that families tend to be focused on the patient and can neglect their own well-being, and a clinical nurse specialist is there for them to lean on as well.
Absolutely. And I think, if there's anybody that's watching this that thinks, oh, I haven't got a clinical nurse specialist, then we would really urge you to speak to your clinical team, because there will be one, or even more than one in certain places. So they'll be able to give you their contact details.
Absolutely, yes. Another great support for our younger patients, anyone under 25, is the Young Lives versus Cancer support worker. Our patients have given really nice feedback on the support that they've had, and their families have had from those support workers. So again, I would really encourage people 25 and under to seek those out.
Absolutely, great. Thanks, Zoe. And with the patients that do need the chemotherapy and time away from school, there are charities that can help with those. So Brighter Futures UK is one that we point people towards as well, who can really help with school and college, and giving people tutors really to help them through, because they do miss a lot of school and college sometimes, don't they?
They do, yes. And there are organisations that you can, and we've had one patient that we work with, and he had a robot. And so he was in hospital on his hospital bed, and his robot went into his lessons. And so it was like he was actually there. So there are amazing resources that are available to patients. So they can either contact us or Sarcoma UK, and we can point them to the right types of organisations, and get the support they need.
And so, Zoe, we know that, for some people, travel just to the specialist centres and everything else that's included that comes along with a bone cancer diagnosis costs money. And obviously, that's not a lot that everybody's got these days. And so there are kind of financial help out there, isn't there? So we at Sarcoma UK are linked with the Charley Ashton Foundation, where people can get financial aid for things like travel. And you guys offer that as well, don't you?
Yeah, absolutely. So we recognise that the financial implications of a bone cancer diagnosis were significant for families, whether it was the parent or a child that was diagnosed. Often parents have to cut down hours at work or stop working altogether. So we launched our financial assistance grants that are available to every newly diagnosed patients, and also our travel assistance grants. So these are available for patients that have to travel to proton beam therapy and also to access clinical trials. So we also try to signpost as well, because there are benefits that patients can be eligible for, such as council tax rebate, and universal credit. So we tend to signpost them to their support worker or to Macmillan on those instances, to make sure that, because it's a minefield really, knowing what patients are eligible for. And it's best to sit down with someone who knows what they're talking about, and help, and they can help the patients with all the forms that they need to complete.
I think you're absolutely right. And we often signpost to Macmillan as well, because they've got their specialist finance advisors that, like you say, know exactly what people can access. That's great. And another source of support, Zoe, is obviously the support groups. We at Sarcoma UK have a number of local support groups that we can put people in contact with. And you guys over at BCRT have your amazing online support groups as well, don't you, for the sites, for the specific subtypes of bone sarcoma?
Yeah, absolutely. So we offer two types really. So we do a virtual cuppa every week, so that's done over Zoom. And then we have our Facebook digital groups, which are the kind of site specific, or primary bone cancer type specific. And they have been a huge kind of support for patients newly diagnosed, and people that have gone through the journey already offer advice and tips. And I think peer-to-peer support in bone sarcoma is really, really tricky because it's so rare. You often are not with someone with the same type of primary bone cancer when you're being treated, and so getting that support. That's why we've gone virtual, to get over the geographical barriers. And we also signpost to your face-to-face meetings as well.
That's great. And we've also got the new bone peer to support service that Andrew Sutton runs. So, we can link people to that. So people can get in contact with either us at Sarcoma UK or BCRT, and we'd be able to point you in that direction. And I think you're absolutely right, Zoe. Peer-to-peer support can be really tricky to get, people with the same subtypes and the people that are really going to have the same experiences together. And I think although COVID has a lot to answer for, it's actually made us do things in a slightly different way that has made it probably easier for people to get together than would have done previously. And I think as we've mentioned earlier, with the people that need to travel to their specialist centres, some of the local support groups would be less easy to access if they weren't online. So the fact that we're all doing things like this now is a real bonus, I think.
It is, absolutely, yes. Our virtual cuppa, that came out of COVID, and we've actually not dropped it because it's proved useful outside of the COVID kind of era as well.
That's great. And, obviously one of the key things that we also get asked a lot is about information. And I know that although Google is a wonderful thing that we all use day in, day out, when it comes to the kind of rarer health conditions, it can be really quite scary for people.
Yeah.
And we're often trying to move people kind of away from the Google searching and being in contact with the likes of ourselves and you guys at BCRT. Do you get a lot of that as well, Zoe, coming through to you?
Absolutely. We often get people that have already done a Google search and are completely overwhelmed by the results that they get. It's impossible really for patients to Google and find out anything related to their specific cases. I'm guessing it's the same with you at Sarcoma UK. We're working with healthcare professionals to encourage them, right from primary care to the specialist centres, to give out the right information and to give out both charities information to discourage patients from going to Dr. Google.
Yeah, absolutely. And I think one of the things that both of our charities are really lucky to have is that backing from the clinical teams. I think they are so engaging with us as charities to
Absolutely.
work on our information so that we get the right information to people when they need it.
Yeah, absolutely. The sarcoma community is very united. It's small, but it's a real community, and healthcare professionals go above and beyond to help us get the information to the patients, but also to make sure that what we're writing in it is accurate. They do all of the editing, they do all the sense checks. They really, really are amazing.
And I think, like you say, because they are so well connected and so kind of engaged, one of the other things that we get often is that people would like a second opinion. Now, obviously, people are entitled to second opinions, but we are clear with people that actually, because the teams work so closely together, everybody's following the same guidelines, everybody's doing the same thing. So unless it's something really niche that one of the specialist centres is doing, then it's really key that you can have that, but sometimes it's unlikely to get another option for you.
Absolutely, yeah. We often get contacted about second opinions, and the first thing that we tend to say is that it is all coordinated. There are MDTs, and particularly in things like Ewing's, there is a centralised MDT, so cases are often discussed by the entire sarcoma service to make sure that each patient is getting the right care. But for access to clinical trials and some of the key things, or compassionate use of drugs, there are certain cases where second opinions are important, and we try our best to help in those certain cases.
Absolutely, absolutely. So I guess the key thing for people newly diagnosed from both of us, Zoe, would be, as long as you're in a specialist centre, you're in the right place. If you need advice and support, we're all here. And so, to be in contact with us and use us as much as they can, and really to emphasize, I think, that we're not just here for the person affected by sarcoma. We're
Absolutely.
all here for their friends and family as well.
Absolutely. We're here for everyone. It's like a ripple effect, isn't it? There's a patient at the centre, and everyone that's associated with that person is impacted, and we're here to support all of them.
That's great. And so if anybody's out there that would like to make contact with us, please feel free to do so. And we hope that this session has been useful for you. So thank you, Zoe. Thank you for your time.
Thanks, Helen.